How's it going, guys? Medium difficulty question for Neuro steps 1 and 2. Dude with HIV, personality change over the past week, and he's also had 2 episodes of pneumocystis during the past year. MRI shows a ring-enhancing lesion in the frontal lobe. Vitals normal. Question wants to know the most likely cause of the personality change. Choice A, central nervous system demyelination. Wrong fucking answer. Doesn't even really specifically refer to anything HIV related. Okay, so could refer to multiple sclerosis in general, right? So woman 20s to 30s, optic neuritis, MLF syndrome, urge incontinence, upper motor neuron findings, Babinski sign, clonus. And so this would be T cell attack against oligodendrocytes slash myelin basic protein, treat acute flare with steroids, decrease recurrent flares with IFN beta, and treat spasticity with baclofen. Wrong fucking answer. Choice B, neurocysticercosis. Wrong fucking answer. So this is going to be pork tapeworm to cestode, and they'll tell you either history of travel, e.g. to Mexico, or they'll literally say the dude was eating pork. Okay, and this can cause a Swiss cheese appearance to the brain. It can cause a ring-enhancing lesion by all means. It can cause cystic appearing lesions in the ventricles. But as I said, they'll tell you history of pork consumption, or they'll tell you that there was recent travel outside the United States, usually to a third world country. You can treat the neurocysticercosis with albendazole. Wrong fucking answer. Should I see primary CNS lymphoma? Wrong fucking answer. Now, this can absolutely be a patient who has CD4 count under 100, who has a ring-enhancing lesion 100%. Okay, what they're going to do is tell you that he's on TMPSMX prophylaxis. Okay, so let me explain. The answer here is toxo. So the prophylaxis for pneumocystis is TMPSMX, which is also the prophylaxis for toxoplasmosis. So if you had 2 pneumocystis infections during the past year, he's not on the prophylaxis for pneumocystis. Therefore, he's not on the prophylaxis for toxo. You could say, well, if you had the pneumonias, he was probably treated with TMPSMX, right? Right, but he's still not on the prophylaxis. This is what MME is going to do. If they want primary CNS lymphoma, they'll tell you he's on TMPSMX, so you say it can't be toxo. That's how it works. Whereas in this case, we know it's going to be toxo. Now, the vitals don't have to be awry. There's no reason to have to have fever or anything like that. Okay, it just presents as ring-enhancing lesions. So PML, this is JC polyomavirus. 2 points I can make. Number one, the MRI will tell you that there's multiple hyperintensities. Okay, they'll say very buzzy. They'll write multiple hyperintensities on T2 weighted MRI. It sounds very technical, but it can show up. And the other point you got to know about this is acute infection in an HIV patient is wrong answer for PML. The correct answer is reactivation of latent infection, meaning you acquired it at some point during life, maybe as a common cold, you suppressed it, and then it reactivates when your CD4 count has fallen. So your short point of consolidation here. And by the way, for those of you studying for 2CK, a little bit more detail, the prophylaxis for toxo is trimethylene sulfamethoxyl, TMPSMX, but the treatment is different. It's sulfadiazine and pyrimethamine. It shows up on one question. Okay. But your short point of consolidation is that an HIV patient under CD4 count of 100, obviously with pneumocystis under 200, but I'm just articulating that in CD4 counts under 100, you got to be aware of primary CNS lymphoma as well as toxo in HIV. Okay, and if they tell you he's on TMPSMX, then you know it can't be toxo because that's also the prophylaxis for pneumocystis and toxo. If he is on TMPSMX and you say, okay, it can't be toxo, it's CNS lymphoma. Primary CNS lymphoma? Wrong fucking answer. You know the deal. When you make more content, if you're looking to subscribe. Appreciate your time. That's it.